Hi, my name is Dr. Leora Mogilner, and I am an associate professor of pediatrics at the Icahn School of Medicine at Mount Sinai and the Mount Sinai Kravis Children's Hospital. I'm also director of advocacy and community pediatrics training for the pediatric residency program.
Hi, my name is Maria Laureano. I'm a children's health home social worker here at the Pediatric Clinic at Mount Sinai Hospital.
Hi, my name is Andreina Rodriguez, and I'm the Mount Sinai Parenting Center social worker.
So starting in 2017, we developed a comprehensive program to screen families for social determinants of health. Social determinants of health are the factors that influence health of families and young children. And those include things such as the physical environment, access to healthy food, poverty, access to medical care. And we know that all of those factors play a really important role in the wellness of our patients and their families. Screening for and addressing social determinants of health has become a really integral part of pediatric primary care in the past years. And so starting in 2017, we developed a screening program at Mount Sinai Pediatrics Associates practice. And we developed a whole host of resources that we could provide our patients with if they screened positive for any social determinants. Prior to the COVID pandemic, we saw that about 25% of our families were screened positive for food insecurity, which meant that they did not have access to nutritious, wholesome food on a consistent basis. And when we had patients who screened positive for food insecurity, we provided them with resources and referrals to local community-based organizations so that we could alleviate this problem. What we found during the COVID-19 pandemic was that the numbers of families with food insecurity has gone up dramatically. So while prior to COVID-19, we had about a quarter of our families with food insecurity, now that number is over 50%. And we realized that with so many families experiencing food insecurity, we needed to do something about it, and we needed to come up with a solution that would address families' needs on the spot and in real time, while at the same time providing them with a more long-term solution to their problem. So our approach to our social determinants of health screening program has really been to look at the patient and their family as a whole and think about all the factors that are impacting this family and influencing their health. And that could be where they live, it could be the access to food that they have or don't have, it could be many factors. So we try to screen for a lot of these issues and address what we are able to, knowing that when we can make a difference in someone's life, we can have a direct impact on their health. As I mentioned before, the amount of food insecurity we're seeing in our patient population has risen dramatically. So the ability to institute a screening program and provide resources on site has really been a valuable and an important service that we can provide for our families. We encourage our physicians and our social workers and our team of trained social determinants of health screeners to screen families at every well-child visit. We also have a team of screeners who call families at home and do a virtual or telephonic screening prior to a visit. So before the patient even comes to the practice, we know what issues are affecting this family, and we can address those issues. During the screening process, if there are needs identified, such as food insecurity or educational concerns or environmental issues, such as pest or mold in the home, we are able to address those issues with the family. So what that means is that we can provide the family with resources. Those resources might be written handouts. They may be referrals to local community-based organizations that can address those problems. And we can do that over the phone, we can do it by email or text, and we can do it in person while they're at their visit to Pediatric Associates. When we saw the dramatic rise in food insecurity during the COVID-19 pandemic, we decided to take action and start a food pantry on site in our practice. Thanks to a really amazing collaboration that we have with one of our community partners, New York Common Pantry, we were able to start an on-site food pantry. So basically what happens is that when patients or families tell us that they have food insecurity or they screen positive for food insecurity, we offer them the opportunity to receive a food package at the visit. Families are given a food package. We take down their information, and if they would like a referral to the near common pantry, we then have the pantry reach out to them, contact them, and set up a meeting. Our prior research showed that of the families that we referred to the near common pantry, many of them did not actually make it to the pantry. And they cited barriers such as the distance or not having the time, having childcare or work responsibilities. So we knew it was not so easy for families to get there when they had to make the first move. Part of our on-site pantry is establishing a connection between the family and the pantry. And we actually put the responsibility of contacting the family on ourselves and on the pantry. So the pantry reaches out to our families and makes that connection. They can screen the families for entitlements such as WIC or SNAP, and they can help get the ball rolling so that the first step in enrolling a family in the pantry is already done over the phone. So in addition to giving food in our clinic on site, we also have the ability to make that connection and get the enrollment process underway. So we've basically created a program where we provide immediate food relief, but we also take the next step and establish a connection between the family and the near common pantry so that we can provide a longer term solution to this problem.
So usually on a day-to-day process, we have screeners throughout the clinic. That could either be the providers, the daily screeners that we have also in our clinic. It could also be us as a social workers. And we all come together and we basically have a family approach and trying to help this family and trying to get the services they need for that day. And that could be just getting a food package, or that could also just mean trying to get them the resource for another food pantry that's available at their barrow. Okay. So part of that would be the New York Common Pantry. They are a great resource, and it makes it even much better that they are kind of a couple of blocks away from us. So anytime we do run out of food, we can do a phone call right away and be like, hey, we need more food.
We also have a host of online resources that we can offer families as well, both for food insecurity and other social determinants. And we have a website that we make available to families, which has proven to be very successful.
I think this project has been incredible, for us as social workers, but also for the families that we have here. Again, like Dr. Mogilner mentioned, we're making that connection with the family. We're making sure that they get their SNAP benefits. We're making sure that they see their provider. We're making sure that they see social work. And we're meeting all these other needs. And I think for the families, it's also just a space and someone to talk to about how difficult this time has been for them, and how difficult the pandemic has been, and how that has impacted their family. So it's also been, a wonderful experience to be able to be that person for these families as well. To be someone that they can, again, like Maria said, come back to us. If they're here for another visit, a lot of families come back to the room and they, tell us how the pantry went, or they tell us, that they need another bag and they're here to pick up. And sometimes they come back to us with other needs that maybe before we would have missed or would have been present for us to address.
This service is a very concrete service. So it's something that they're receiving at the end of their visit or before their visit. Sometimes what tends to happen is with social work, we have to take a step back and kind of reevaluate things and do things from a different perspective. This gives us the opportunity to give them something after the visit. So it's been a very amazing journey, and it's just a wonderful experience for both parties.
And I've been very excited and grateful to Dr. Mogilner. I mean, you've done an amazing job here and just giving us this opportunity to be part of this project and, be there for these families and meet this need that is pretty high during the pandemic. And I'm personally very grateful to be part of the project and to be able to, do help these families during these times and be able to be involved in such a wonderful project that we have for our families here.
I just want to add, I think we've all seen and we've all experienced the impact that the screening program and the food pantry have had on our families. And I think we all feel that it's making a difference in families' lives. There's no greater reward than that, than to see something like that.